Hi again. This is Dr. Mark Skeen, an associate professor of neurology at Duke University Medical Center, and specialist in MS and related conditions. So this is one in a series of videos just helping to educate or inform regarding multiple sclerosis and related issues. In creating these videos, I'm trying to address common questions or concerns that folks have in multiple sclerosis. And one question we get frequently is, well, what about stem cell therapies? So I thought I would make this short video to give an overview or a summary of stem cells and stem cell therapy, particularly as it relates to multiple sclerosis. So first, let's talk about what is a stem cell in general terms, and why there's so much excitement about stem cells and controversy, and what's the reality of stem cells. So what you have to understand is that in the fetus, cells start multiplying, and those cells originally, the stem cells, are what we call pluripotent. What that means is that they could turn into anything. They could turn into a bone cell, or a brain cell, or an eye cell, or a blood cell, or a liver cell. So they are not yet determined what they will be. What they will be is determined by a number of all manner of controlling influences and controls on genetics and other signaling molecules is the short answer. But so a stem cell, the advantage of a stem cell is that if we were smart enough and clever enough, we could turn a stem cell into whatever cell we wanted it to be. And that's why there's so much excitement about stem cells, is that if we had stem cells and we could put them into tissues or areas of the body where cells had died, and we could turn them into the cells that had died, we could create new tissues or replace cells that were injured or dying. And so that's one of the very big promises of stem cells conceptually. When it comes to multiple sclerosis, I guess I should say, when it comes to neurologic diseases, there's been a lot of interest and in replacing dead or dying nerve cells with cells that came from other places and were stem cells, and then be able to turn them into brain cells and replace the tissues that were lost. It remains a very promising field, but I would say for the most part not particularly successful field so far. And that largely has to do not with the potential promise of the approach, but from our lack of understanding of what it's going to take to actually accomplish it. When it comes to MS, most of the efforts in using stem cells to try to result in improvement in multiple sclerosis have been aimed at improving remyelination. So the damage that's done in MS, at least the focus of the damage, if you will, is the myelin, which is the insulation on the nerves in the brain and spinal cord. And the idea is that if we could put some stem cells in there, turn them into the cells that make myelin, then indeed we might be able to remyelinate or heal the damage of multiple sclerosis much better. For the most part, we have not been able to do that. And it doesn't mean there hasn't been any benefit, but we haven't really been able to accomplish a greater degree of remyelination by introducing stem cells. So the flip side is that, in a sense, however, stem cells have provided a cure for multiple sclerosis. So a few years ago, I was asked to write a short blurb about when will we have a cure, and I said, well, we already have a cure, and that is bone marrow transplantation with implantation of stem cells. So in various conditions such as metastatic cancer and other devastating diseases, we can do bone marrow transplantation as part of a overall strategy. And the issue is this, that when we use powerful chemotherapeutic agents to destroy tissues within our body, it often destroys the bone marrow, which is where all of the cells that create blood and the immune system originate. So if we destroy the bone marrow, we kill the immune system. And the idea behind using bone marrow transplantation in autoimmune conditions, which has been done successfully, is to destroy the immune system, then reconstitute the immune system by giving stem cells to get a jump start on recreating a new immune system in order to have an immune system which no longer has the defect responsible for multiple sclerosis or various other inflammatory or autoimmune diseases. And it works. The challenge so far is that going through a bone marrow transplantation is like going through the worst chemotherapy regimen that you can imagine. And the danger is high. The danger is not high if you have a terminal and otherwise untreatable condition. Then a 2% mortality from bone marrow transplantation may look like nothing to risk at all. But in a condition such as MS, where the mortality is very, very low, in fact, MS usually does not kill people, then taking a 2% risk of dying from the procedure seems quite risky. So that's what I would say is the challenge of bone marrow transplantation, and there are improvements being made all the time. And perhaps we're nearing the stage, and there's some data to suggest that we are, where the mortality from bone marrow transplantation could be significantly less than 2%. So we do have, in a sense, a cure for multiple sclerosis that involves stem cells, and that's bone marrow transplantation. It's just a very powerful and dramatic solution with significant risk. And so the question is, who should take that risk? And that remains a challenging question for many of us. Now, I should also mention that there are all manner of stem cell therapies being offered throughout the country and elsewhere. And most of it should be avoided, just to be very blunt. So most of what goes for stem cell therapy for various conditions has very little scientific basis and very little substantiation even of safety. How are you going to know? The best way I can tell you is that if you are considering stem cell therapy for MS, if it's not part of a research trial, you probably should avoid it. And if you're having to pay much for it, you should probably avoid it. And I hope that changes, and I hope we find ways of harnessing the promise of stem cells to benefit folks with multiple sclerosis. But we're not there. And there are all sorts of things being done, taking fatty tissue or other tissues from the person's own body and processing them in some manner, calling the result stem cells and injecting them back into the same person. And you should just know that there is very little substantiation of benefit and or safety from these approaches, and I would avoid them. So stem cells hold a lot of promise. For the most part, as it regards to multiple sclerosis, that's future promise and not current promise. And the exception is those folks for whom the risk of bone marrow transplantation represents a good risk to benefit ratio. In that circumstance, stem cells can truly benefit folks tremendously with MS, but that's a small number of people or proportion of the folks with MS at the present time. So I hope that information is helpful. I would love to give you a different view of stem cells, and I'll certainly make a newer video if we have more promising information. Thank you.